Okay, Dr. Kelsey, thank you for joining me today, and I look forward to getting a little more of a story from behind why you got into be a doctor of naturopathy or naturopathic doctor, sorry. And yeah, can you give us a little bit of a background there? What got you interested in that?
Absolutely. So first of all, thanks for having me on here. This is really fun.
Yeah.
So I, didn't really find naturopathic medicine in the most traditional way. It's not something that I ever actually really knew existed until I was in college. I was raised in a very conventionally minded medical family. My dad was an RN, and never really had an interest in becoming a doctor or being in medicine because I wasn't really interested in the conventional medical field. When I was in high school, though, I started having some of my own health issues. I was getting chronic migraines to the point that were almost daily. And I got really, really bad eczema, which is a nightmare for any teenage girl, especially when it's on your face. And I just wasn't finding solutions through the conventional route. I saw a dermatologist, now that was helping. I saw a neurologist and was put on antidepressants as an off-label use for migraine treatment, and none of it helped. And what I did find was that it actually, from being on that antidepressant for my migraines, was starting to make me depressed. And when I spoke with the neurologist about that and told her, I know that these are common side effects because everybody talks about it, she pretty much wrote me off and said, no, that's not possible. The dose you're taking is too low. And I just felt so unheard, like I knew my body and I knew what my symptoms were. And that kind of set me on this path to try to figure out something else. And, I started just playing with different food and thinking about, like, why is it that no doctor is ever asking, like, what's your stress level, or what kind of pillow are you sleeping on at night that could be affecting your back and, could be affecting all these things. And I ended up finding my way into a college course in holistic health. And one of my teachers, who was part of that course, was a naturopathic doctor. And he introduced himself. He explained what, the philosophy of naturopathic medicine was. And I was just blown away. I was like, oh my God, you exist. Like, this thing that I've been asking for exists. And I started taking more of those classes and just became really enamored with this idea of, treating the body in a way that helps the body heal itself. And that led me down the journey of becoming a doctor of naturopathic medicine and helping other people with that now.
Oh, great. Excellent. Yeah. It's been a little bit of a journey for you.
It has. It has.
Excellent. Well, we're going to be talking about mental health and anxiety today. So in that context, with what your experience is as a provider and in this field of mental health, can you give me an idea of what you think some of the common misconceptions are in the treatment of these disorders?
Yeah, I mean, I think there's a few. I think right off the bat, there's a common misconception that they can only be treated with medication, right? That you have to be on an antidepressant or an anti-anxiety, antipsychotic type medication. And what I find really unfortunate about that is it's so common, especially in the teenage population, for adolescents to be put on these. It's almost like, I remember when I was a teenager, it was like, I knew what an antidepressant was, because everybody was on one. And I think that's one, really disheartening and really disconcerting, because when people go on these medications, especially from a young age, it develops this fear of coming off of them because they don't know what life could look like without the medication. So I think that's one piece, is that they can't be managed without medication. I think that's a misconception. I also think that, related to just the stigma that surrounds mental health in our culture, there's a common misconception that if you have anxiety or depression, then you are alone in that, and there must be something wrong with you. You must be some broken, and that there's not other people who are dealing with this. And what I tend to find is that almost every patient who walks into my clinic is struggling with mild to moderate anxiety or depression or insomnia. It is very, 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 very common, and absolutely manageable.
Gotcha. Yeah. Excellent. Well, so with your profession, what are some misconceptions that people have about naturopathic type of medicine?
I think there's a lot. I mean, first of all, I think a lot of people just haven't heard of naturopathic medicine, so they don't even know what it is. Most of the time when I tell people I'm a naturopathic doctor, they're like, wait, you're what kind of doctor? So I think most people don't know what it is. I think the people who do or have maybe heard of it either think that either it isn't real medicine. You know, people always say like, oh, when I was talking to a real doctor, I was talking to a regular doctor. Or they think that what I do is very like woo-woo energetic medicine, which I do a little bit of that, but that's all it is. There's a common misconception that naturopathic medicine is exclusively homeopathy, which it's not. Homeopathy is just one therapy that we're trained how to use. And then there's a common misconception that naturopathic medicine isn't scientifically backed or practiced by real doctors. And that's actually not true. So in order to become a naturopathic doctor, you have to go to a nationally accredited naturopathic medical school. There are very few of them, but they do exist. And you have to pass 2 sets of board exams. You have to get registered in your state or licensed in your state. And the schooling is essentially identical to conventional medical school when it starts off. We still do all of the same science courses because, you know, if you come into my office, I need to know what hypertension is, and I need to know these things. We still learn pharmacology because most patients are on medications and we need to understand how those affect the body. And then our education diverges when we go into more of our therapies, the things that we really shine in and really love, which is like herbal medicine and nutrition and lifestyle and physical medicine, like spinal manipulations, and getting more into that actual like counseling, lifestyle, functional medicine aspect. That's what we're really experts at.
Gotcha. Excellent. So this is a niche area for you in your practice. Is that correct? With the mental health side of things that we've been talking about? Okay, excellent. So let's see, what are some of the factors you look at or you test for when somebody maybe comes into you looking for help with mental health challenges?
Great question. So I'm looking at a few different things. So first of all, I always want to talk about lifestyle, right? And that may seem really obvious, but most people could use some support here, right? So I'm usually talking to people about their stress level, what contributes to the stress, and if they're doing anything to help mitigate it. Usually talking to people about sleep. Most people are not sleeping enough, and when you don't sleep enough, it actually does trigger a stress response in the body. I definitely talk to people about nutrition because it's not just the number of calories you're getting, but the type of calories that can contribute to blood sugar imbalances or protein deficiencies that can also cause more anxiety and depression. And then obviously movement, right? Body movement, I think, is one of the best therapies for anxiety and depression because of its effect on the chemicals in the brain. So we're definitely talking lifestyle. We also talk a lot about gut health. I have probably, in the time I've been practicing, only ever had maybe 5 patients who didn't have some gut imbalance going on. And we know that 95% of your serotonin, which is one of your anti-anxiety hormones, comes from the gut. So if there's a gut imbalance or inflammation or food sensitivity or something like that going on, then that could be playing a huge role in brain health as well. And we also know, and you and I both know this, that the gut has its own nervous system. It is a second brain in the body. And so we need to make sure that that nervous system is calm as well. And then once we have those kind of figured out, this is something I focus on and specialize in my practice. I really like to look at people's neurotransmitters through lab testing. And so I actually like to look at the balance between your serotonin and GABA and dopamine and all of these different little chemical messengers that can really shift the balance in how you deal with anxiety, depression, OCD, lack of energy, too much energy, lack of libido, those types of things.
Gotcha. Okay. And then how do you work with, when patients come in to see you that maybe have some of these challenges or other challenges, how do you work together with other providers potentially for things maybe that are not in your scope, or that you're maybe not comfortable working with on a like one-to-one basis? You're like, well, we need to bring in this provider to help with this other problem that maybe we're not able to fully address.
Yeah, so I think that people benefit from having a care team, right? Who all are working on behalf of that patient. And so it does depend on each individual patient what I'm going to recommend. But for some of my patients, they absolutely could benefit from having a counselor or a therapist on their team. And while I do some level of counseling in my practice, sometimes what they need is more than that, right? And so having somebody they can really partner with there can be very helpful. If they're already on a medication, it's very important for me to try to at least engage the provider who prescribed that. I'm not always successful in getting a response. But as the person who's managing their medication, it's not really appropriate for me to change that. And so it would be ideal to have them on board, know that I'm working with this patient, let them know that, this is what I'm testing. These are what the results found. This is what the patient's desires are. This is how I can support this. And, sometimes patients are fine with staying on the meds, and sometimes they want to wean off of them. And that's something I can help with. It's something that the therapies I can provide can help provide stability so that their medications work better, or that they don't need as much of them. But that's definitely something that I would prefer to work alongside other people if they're willing to work with me. And then some of my patients need other pieces to help trigger that kind of rest, calm, parasympathetic nervous system, like a chiropractor or an acupuncturist or some kind of body care worker who's helping to reset the nervous system that way.
Okay, excellent. And then just in wrapping up here, can you maybe give us an idea on some other specialized areas that you work with outside of mental health, as well as how do people find you if they want to get more information or chat with you to see if it would be a good fit for them to work with you?
Yeah, so I love working with people who have anxiety and depression. It's just something I see a lot of, but my typical client is a high-performing professional. So I work a lot with CEOs and entrepreneurs and athletes and people who are real go-getters in their lives and just like they've got this thing going on that's keeping them from having the edge, right? And so I do primary care from a naturopathic lens, which means while I do work a lot with anxiety and depression and sleep and OCD type things, I'm also working a lot with gut health. I sometimes am doing thyroid support for people who have a little bit of that subclinical thyroid to actual thyroid conditions. So, I mean, I do see the gamut, but I would say what I mostly see because of my patient population, it's a lot of just correcting underlying imbalances in the gut or with inflammation or, with some of these little chemicals that just need tweaking to give them kind of that advantage in what they're doing professionally.
Okay.
And then as far as finding me, I guess that was the other part of your question. So I am the owner and manager of the Denver Naturopathic Clinic. So people who want to reach out, I do offer a free 15-minute discovery call for any person who is interested in learning if naturopathic medicine may be a good fit for them. I think it's really important that people find a good fit before they go in. So I'm happy to offer that. My website is just denvernaturopathic.com. You can reach me by email at frontdesk@denvernaturopathic.com. And then I'm also on Facebook and Instagram at Dr. Kelsey Asplin.
Excellent. Great. Well, thank you for the information, and look forward to doing further interviews on other topics with you, and I appreciate your time.
Likewise. Thank you so much. And I would love to ask some questions to you as well. I know that you and I both work with patient populations who have similar concerns with mental health, but we're obviously different types of practitioners. So why don't you give us some information about your background and how you came to be a chiropractor?
Sure. I probably experienced chiropractic initially, like a lot of people in our culture think of chiropractic from, say, a back pain or neck pain perspective from playing sports. I got hurt periodically, and I experienced a fantastic relief through chiropractic. And then as I was trying to figure out what I wanted to do with my career during college, I reflected on my experiences with chiropractic and talked to my family chiropractor, and I felt like it was a good fit for me because it was a drug-free approach. I wasn't pushing pills on people or surgeries, and I could be my own boss. I didn't have to worry about my job being outsourced, and I enjoy helping people as well. And so through that, I pursued my career in education there. But again, I was looking at it from the lens of more like a sports injury pain based background. And as I was in school, I was actually seeing parents bringing their kids into our clinics that were having ear infections or reflux or torticollis or these other problems. And so that opened my eyes to seeing, oh, people are actually getting these changes with other conditions that aren't back pain related or aren't injury related. And so that expanded my focus. And what really flipped the switch for me was when I had a severe episode of back pain where I could barely put my pants on or get my shoes on. And this persisted well over a month. And at that point in time, I started working with a fellow colleague that showed me how I'd been addressing things was more from not the cause side, but the effect side. I was looking at it from the symptom side. And so once he showed me what was going on more on the cause and started focusing and addressing that, that changed things for me, not only personally, but also professionally, where it's like, we need to look more at the nervous system, how the nervous system is functioning, because that is directly controlling all the different functions in our body. And so with that, I changed, my professional calling per se to go from being more sports medicine injury focused to being more holistically focused, looking at the nervous system and how that impacts all the different functions of our body, from our glandular functions to our digestive functions to everything. And so that's how I got into chiropractic and how I'm currently practicing and helping my patients recover from different ailments and support them in their pursuit to optimal health and healing. So yeah.
That's awesome. I feel like you and I are very similar in that way in terms of trying to really get down to the root cause, right? Instead of just treating the symptoms. So I think that's really great. Now, chiropractic medicine has, been around for a long time and has obviously been, kind of through the ringer, actually. So what do you think are some of the biggest misconceptions about chiropractic health that people maybe have incorrect?
Well, I think there's some people that hear about chiropractic, they're like, yeah, I know what it is. I'll go whenever I might need it for my back pain or neck pain. And that's, what I think a lot of the Western culture views it as, is help for neck and back pain. The very first documented chiropractic adjustment, though, helps someone restore their hearing. And it was initially founded more to help with visceral problems, or problems with the organ system, arrhythmias or digestive issues and complaints. And then the byproduct also was like, oh, my back feels better. And so when insurance came around, it became more Western medicine focused on more pain symptoms, dealing with like neck pain, back pain, maybe headaches or sciatica as well. And so that is probably one of the biggest misconceptions. I think there's a lot that can be done with the right chiropractor, because there's definitely a difference. Just like I started off, most chiropractors are more pain and injury rehab focused than they are more the holistic function of the nervous system and how that is impacting the whole body.
Yeah.
So that is the biggest misconception I see. And the second one is that one size fits all approach. Like if you think maybe what some people may think of a chiropractic adjustment with the twisting and the popping, there's different types of adjustments. Some of the instruments we use don't even require any of that twisting or popping. So we can meet people with where they're at. So if they have hesitancies towards that, then we can actually change that for them and make sure that they don't experience that and they have a positive experience with their health and healing in our office.
Yeah, I can actually speak to that as a patient of chiropractic. So I have to say I do kind of love the twist and pop, but it's not good for me because of the conditions I have in my own body, right? And so I learned and was really appreciative of the fact that like there is so much more to chiropractic and how they can adjust in ways that are a lot more gentle and kind of guiding to the body and work on a more global level. So I think that's really great to bring up. What do you feel personally are the biggest differences that separate you and how you practice compared to other chiropractors?
Well, I already touched on it a little bit, but I focus more on the nervous system versus like this part of my body hurts. So let's just focus on that part that hurts, right? Our spine and nervous system is like a setup of dominoes. If something happens up here, we can still see a problem over here where the dominoes are all falling, right? And so there's different scans that we do in our office. I'll just pick this up and show it in the screen here, but this is one of the scans that gives us an idea of how the nervous system's working from the inside out. It doesn't tell us about symptoms, but it tells us that there's an imbalance in the sympathetic or parasympathetic nervous system, or sorry, the autonomic nervous system, where the sympathetic and parasympathetic should be in balance. But oftentimes, even when as we were talking about mental health, like with anxiety, oftentimes people are really highly dominant in that sympathetic nervous system and they get fried, they get burned out. And so what we're doing is helping to balance the nervous system. And the byproduct of doing that is oftentimes a lot of their symptoms, the effects of the nervous system malfunction, those start to improve. And it's all because the nervous system is becoming more imbalanced, and that helps to restore like metabolism. It helps to restore like more normal glandular function as well.
So to go further on that, what are your specific techniques? How do you specifically help people? And because we're talking about mental health, so how do you use your approach and your kind of understanding and way of looking at chiropractic health to support patients with anxiety and depression?
Sure. You alluded to the stomach being the second brain, right? And right off the brain stem up here, which goes right through the spinal column, is the vagus nerve. And that is a huge player in the parasympathetic regulation in our body. So if we have really low parasympathetic tone and high sympathetic, the chiropractic adjustment actually helps to regulate that and bring things more into balance. And so the scans that we do are things that we repeat periodically with our patients to manage how their body is responding and coping with their daily stresses that they're experiencing. And as somebody's under care, we typically see those scans showing that there's improvements and things are calming down in their nervous system, and they're getting healthier signals through the vagus nerve to their stomach. And so that also helps with the serotonin production that you're mentioning and regulating that, as well as helping get healthier signals back to the brain so the brain can be more calm and be regulating itself better because of the healthier transmission of those signals in the nervous system. And we just tap into it through the spine and providing impulses to the nervous system, help with resetting it and restoring more normal communication.
Yeah, that makes a lot of sense. So you had asked me about how I work with other providers. I'm also curious about you, because I'm sure a number of your patients come in who have other providers, especially if they have mental health concerns. So how do you interface with their other providers?
Well, much similar to, it sounds like your story, you definitely, I try to reach out and work with them to let them know what we're seeing, what we're doing with their patient or a mutual client or patient, and trying to work together to help the patient get to where they want to be. And sometimes we get good interaction, other times, unfortunately, we don't. And we just do the best we can for our patients. And when the team approach is available and open to being a team, then we definitely like to dive into that to help our patients the best we can, whether it's from a massage therapist or acupuncturist or naturopathic doctor or mental health provider. I want to work with everybody and try to come up with the best approach for health and healing for that person.
That's great. So you obviously have like a very unique and specialized approach to chiropractic, which I think is really great. So for people who are interested in learning more about that and how maybe they can benefit from it, how could they get in touch with you?
Sure. I also do offer a complimentary like discovery call with my hope for patients when they call or wanting to inquire. I always do that as more of like just a screening process to make sure what they're looking for would line up with what we do here in our office. So they're not wasting their time if it's like, oh wait, that wasn't a good fit. I want to make sure that we figure that out and make sure it's going to be a good fit from the start. So we can honor each other's time and respect each other in that manner. And so we do that initially, then we have people come in if it seems like it's a great fit, and we get the process started with doing different neurologic tests and exams. And depending on what we see from there, we outline the best next course of action, if there's other additional tests that are needed, or if it's to start with care. And I feel like we do a really good job, because I've heard this from patients telling me this, that've been to other chiropractors. That was really thorough. And that's a lot more information than I ever realized was going on with me. So I have better understanding of how my body's working and how to address this. So,
which is great. I feel like so many patients, because I hear similar things. I think so many people just aren't given the attention or space to really tell their story and really be heard and really understand their body. And so I think it's so great to be able to provide that for people. And it's great that you're doing that.
Yeah. And I tell my patients, bottom line is I need to hear what your concerns are so I can properly address them, and we can have an open line of communication, because it's not just one size fits all. There's different techniques that we use, and everybody's body is a little bit different. And there's different seasons every person's body goes through as well. So we might be doing one thing with somebody for a while, but then we need to actually change that up and not necessarily continue to keep doing the same thing that initially was working. Now it doesn't seem like it's being as effective. So now we need to change.
Absolutely.
So, yeah.
Well, this was great. This was such great information. I feel like I learned some more things about you and your practice. So thank you so much for organizing this and chatting with me today.
Yeah, and the best way as well, since I forgot to mention it.
Oh yes, how do people find you?
The name of my practice is Lifetime Wellness and Chiropractic in Denver. Our phone number is 303-399-3569. And they can find us online at Denver-Chiropractor, and they can submit an inquiry if they want to come or have an initial phone call, the complimentary phone call, as well as we have we can be found on Facebook as well. So yeah.
Awesome.
Well, I appreciate your time today, Dr. Kelsey.
Thank you.
Yeah, and look forward to chatting with you again soon.
See you next time.
Yeah, indeed. Cool. Here it is.